Hello, everyone. We've started the broadcast, but we're going to be waiting for the last few people to join and for you to test your audio. So we'll be starting the webinar in 30 seconds. Well, we're about to start. Beth, can you confirm that you can see my screen?
Yes, I can confirm.
Perfect. So, good afternoon, everybody, or good morning, wherever you are. Here in New Zealand, it's 8 in the morning, but in New York and Florida, where Mark and Anna are, I believe it's 2 p.m. So, depending on what coast you are or what part of the United States or the world, uh, welcome. Welcome to our customer panel webinar, where we will be looking at the new reality of healthcare, IT, and general communications. We're lucky to have a duo of professionals that are at the forefront of healthcare communications and have very different perspectives for that matter. So Mark comes from the IT world, and he clearly looks at the tools and the channels that we use to communicate. And Anna, she comes from a more humanistic communications perspective. So we're looking at the messages, but also how we deliver those messages. Now, before we start, I do want to thank everybody for joining and taking the time to learn something new. Hopefully from our panelists, we will be looking at some examples of how they're communicating, the channels they're using, and how they prioritize their messages. I am aware that many of us come from different backgrounds, including HR, IT, internal communications, operations. So we have a whole bunch of people from very different backgrounds here, and I love that because it can show how can we work together to communicate effectively to our healthcare staff, especially in a complex, fast-paced environment as the one we're in. Now, if I mention it has been a tough year, I think it would be the understatement of the year. We've all had great challenges being at the forefront of a fight against the global pandemic. So I think it's really important to recognize the labor you're doing as healthcare heroes and making a difference in people's lives and making such a positive impact. So it's really important to recognize the doctors, the nurses, of course, but also the technicians, the IT staff, the back office teams that are actually making all of this happen. So I think teamwork has been the building block of many healthcare institutions and how we've been able to withstand so many challenges in such a short period of time. So hopefully we can focus on that in this webinar and look how with teamwork and good communications, we can actually make an impact on our staff and the people that we serve. So in the panel, we have Anna Wood, that is Creative Director at Opus Senior Services Group. And she actually, as Creative Director, she looks at both external and internal communication, among other marketing initiatives. So she's really looking at the messages that we're sending, at crafting these messages and making sure that they have an impact both for employees, but also for um, the patients, customers, and people receiving care in her institutions. So Anna, welcome and thank you very much for joining.
Thank you so much.
And on the opposite side of the spectrum, we have the perspective of IT. So we have Mark Rieger, who is Corporate Director of IT Operations at New York Presbyterian Hospital. As we all know, New York Presbyterian Hospital is one of the largest in the nation. The third, if I'm not mistaken. It's got a great history being one of the first hospitals in the country as well. So Mark has been in the IT world for a while now. He joined as CEO of the New York Hospital at Queens, and that has become part of New York Presbyterian. So he does know what he's talking about when it comes to communication tools and IT helping different departments fulfill their objectives. So again, welcome, Mark, and thank you very much for joining.
Thank you for inviting me.
Now, at the back office, we have and helping us run the webinar, we have Todd Lewis and Beth White that will be supporting with all your questions and the comments that you have that you will be able to do in the chat box in the program. My name is Carlos Escobar Dreher. and I will be moderating this debate. So basically, the less I speak, the better I do my job. We have some great speakers here, and hopefully I'll be asking the questions, and together we will be sharing and learning what it's like to be communicating with staff. Now, we're holding this panel because we believe that communication is the lifeblood of hospitals and healthcare organizations. At times of rapid change, as the ones that we're living in, it becomes increasingly important to be able to deliver crucial messages in time to a very complex workforce. And we have to make the possible and impossible to keep everyone safe and healthy, but also informed, and knowledge is power. So we really need to make sure that we can share the knowledge that is important to be more effective. Now, at SnapComms, 1/3 of our customers are in the healthcare space, and with over 15 years of working together, we've had really deep conversations about the complexities it involves sending messages to such a diverse and mobile workforce. So when we're talking about staff in hospitals and healthcare institutions, as the one Anna works in, we're thinking about IT staff, admin staff, clinical staff, and doctors and nurses that are on the floor, and even structure and maintenance staff. So we're talking about a very diverse workforce. And crafting a message using the right language, but also the right tools, is very important. So the message, I mean, that's the core of what we're sharing, and it's really important to be careful around it. But also, we cannot forget about the tools, because in the end, the technology that we choose to share this message will have an impact on how it's delivered. So it's really important to have a good ecosystem of tools that help our team keep our staff trained and informed, and help us have a good reaction to an important change happening, get reinforcement of certain messages and training, and even, give our staff moral support in stressful times like the ones that we're living in. Now, at SnapComms, we are a cloud software platform that bypasses email and pushes important messages to employees on any device, anywhere. And obviously, this includes many hospitals and clinics around the country and around the world. And yes, we pride ourselves in working with over 2 million people and delivering messages to more than 2 million people, making sure that they're informed and they know what to expect from their leadership. Now, with SnapComms, you can actually prioritize the messages that need the most attention while delivering in a channel that helps you achieve your communication objectives. So whether it's an urgent message that needs to be read now, or something that we need to reinforce that doesn't need immediate attention, ideally, we help you achieve both objectives. Now, we're about to start, so I'd just like to share some housekeeping notes so that we know how this works. And I guess we are all used to webinars and conferences by now, but the session will be recorded and shared with you later. Everyone will be placed on mute for the duration of the webinar, but that does not mean that we don't want to hear from you. So please use the chat box that you have available to ask any questions, and our moderators and helpers will try to answer them when appropriate. Now, we will be having a Q&A session in the end, and hopefully we can answer most of your questions there. But if we don't, we'll hopefully be able to send an email with the replies that you'd expect. In terms of the agenda, we're just looking at the general overview of what we're going to be covering. And then we will start by looking at the common problems hospitals and clinics face in reaching out to staff. This will be kind of our starting discussion, which will evolve into how do we overcome these challenges, and how do we work together to maximize the reach and impact of our communications. We will wrap it up by looking at the most valuable lessons that we've learned in 2020. I think we've all learned something this year. It has been such a surprise and such a dynamic environment that we cannot say that we haven't learned anything. And hopefully we can all take something that we can implement in our workplaces next year. So before we start, let's take a look at the 4 challenges that our customers have shared with us. We did 110 interviews last year, sorry, at the beginning of this year. I think it has passed so fast that I lose track of time with a few lockdowns and everything. But yes, we did speak with 100 of our customers, 30 of which were in the healthcare space, and they shared these challenges that they face when reaching out to staff. The first one was communication overload. There were too many messages with too little relevance being shared. And this is quite similar to what we see in many industries. There's so much information that it's hard to filter what is important from what it's not. The second challenge that we saw was, especially for hospitals and healthcare institutions, we have quite dispersed workforce. Staff working across multiple locations, like with New York Presbyterian, there's quite a few campuses in the city. And state, there's different roles from clinical to admin, and there's different shifts. So we have a very complex environment that we need to reach out to. The third challenge that we also saw quite recurrently was the workload pressures and the demands of the job meant that the staff often missed messages. Of course, if there's a patient in critical state or something, we do, attend that before we listen to what I guess our colleagues or leadership is sharing. So it's really hard to reach out a staff that is so engaged in other activities. And the fourth challenge that came from our survey and deep interviews was that it was troublesome to target and segment people because the workstations spread in the hospitals and healthcare institutions are harder to reach than if you have a fixed computer. So what happens is that nurses, doctors, and admin staff often use shared terminals in the hospital floor, and it's really hard to be able to reach them when they don't even open their emails, they don't look at their phones, but they just consult something really quick in one of these stations, so it can be really hard to reach. So before we start, we do want to hear what you have to say about this. I'm going to launch a poll here, so you can actually share. If you share these same challenges that were expressed to us earlier this year, or if you have other ones. So if you can just click on the poll that you have available in your screens and let us know your opinion of which are the greatest challenges for you. Now, if it's not here, we encourage you to please put something on the chat, and we will also be sharing that. So I'm going to leave this open for a few seconds, but we're already getting quite a few responses. So let's wait another 10 seconds. And again, if there's another challenge that we haven't taken into account, please just share them in the chat, and we will be sharing those as well. Perfect. So we're still receiving quite a few responses. I'll wait another 5 seconds, 6 seconds. Let's go. And perfect. I'm closing the response and sharing the responses. So, I mean, communication overload seems to be the greatest challenge we all face. We have so much information. Anna and Mark, in our conversations that we had before, this is something that you mentioned was probably your greatest challenge. So, looking forward to talking about that. Workload pressures was the second largest one, with 60% of you saying it was one of the big challenges you face. Trouble to target staff and segmenting, that was 32%, and the fact that people were dispersed, 24%. So I mean, it was quite I mean, we expect the communication overload to be the greatest. It's always quite a complicated challenge, but thank you very much for sharing. And I'm going to hide this and go back to the presentation. So without further ado, let's start our panel. And I think I mean, now that we've received the opinion of the people joining, what do you think, Anna? Let's start from the warmer state, Florida. So let's start with you. What do you think of these challenges? Most of the respondents did agree that communication overload was the greatest one. Do you agree?
Yeah, I definitely agree. As employers, we were getting a lot of information and still do, and it was ever changing. Every day, it was new information from our local and state and federal government agencies. So we were just getting, collecting all that information and getting it out just as soon as possible, to our people in the front lines. And we were meeting every day and just collecting all that together and just giving it, giving all that directly to them, whether that be on our SnapCom slides, calls, meetings, things like that.
Perfect. So during normal times, we have quite a bit of information, but during a pandemic that's actually affecting both our institutions, this information probably increased, didn't it?
It very much increased. I mean, it was every day. And it's not as every day as it was before, but it was definitely an everyday amount of information. And we felt that as well, that struggle of receiving so much information. But, it was also, we had that duty to be able to give that to our frontline staff. And we realized that it was a lot of information, and we definitely empathized with them on that. But we also wanted to make sure we got that information out to them and the resources they needed. Also with our customers and families as well, the resources they needed.
Yes. Yeah, it's really important to know how to react under these circumstances, how to use PPE correctly. There's so many things that we need to communicate.
Right.
So Mark,
Yeah.
how about you? Sorry.
No, you're fine.
Mark, how about you? Is it a similar experience for you?
Agreed. I mean, the communication overload is there's a clinical term that we use in the hospital called alert fatigue, where if you ever go to an ICU and all you hear is beeping, if it's beeping all the time, people stop paying attention. If you're sending a SnapCom message every 15 minutes about cookies in the conference room or happy birthday, Bubba, it's just not getting to the audience you want to. So we have a very strict rule about when the messages are sent, how they're sent, and what criteria they use for that. Between, like I mentioned before with you about the SnapCom, we have a couple other different venues of how we send messages, but there are very tight criteria. And like Anna was mentioned before, this year out of all the years, every day is a COVID alert. Every day is we're doing this. Between March and June, we learned every day how to deal with COVID and what to do and what should we not do and how to address it. And so in our organization, we try to consolidate all those messages to a single venue. Like every morning, the CEO is getting on and having a town hall every day talking about the message that we're talking about. I utilize SnapCom mainly for outages and scheduled issues. And we make sure that they're important and they're clear. And that, it's not the ticker tape running on the bottom of your computer like you're a Wall Street person. When it pops up, you pay attention because, oh, the snap comes up. What is it telling me? I know that this must be important because they only use it when it's important.
Perfect. And I really like how you mentioned that with so many messages going out, all the beeping and all the sounds and all the images, it can become part of the landscape. Like our brains tend to ignore, like when we have so many pieces of information out there, we might just ignore them altogether and miss what's really important.
Right. Yeah. And then how we've utilized SnapCom for the current state is that we've, like you had mentioned, I think earlier for us, is we were using the screensaver slides, which are running on 1,200 devices on our in our organization. That we've got slides up about PPE. We have slides up about wearing masks properly, good hand hygiene, all those reminders. Just to help them, because like you said earlier, they have a lot that our frontline team are doing, and they're caring for people. So I think those little reminders just help them, and they like them. They like the information.
No, that's a really good point, Anna. And you've started sharing a bit how your organization actually solved some of these problems. You're talking about using different channels to reaching people where they need. Can you expand a little bit on how you address these challenges, especially communication overload, and how are you able to make sure that the messages that are important actually get delivered?
So we don't just use one platform or way to communicate to our team and to our families and customers. We in addition, just for team members, in addition to the SnapCom slides and letting them know about, specific, if we have hand hygiene, for instance, like that, we would then also, maybe post something online to social media, and just hitting all the different channels that people are on, so that we can get that. They may not see it in one place, but they'll see it in another place. So,
Okay.
and then,
So we're talking about message saturation when it's something that's really important. So if it's something that needs to get across, we try to use more channels that have kind of a wider breadth and penetration.
yes, absolutely.
Perfect. How about you, Mark? Now, we've talked about communication overload being the greatest problem for New York Presbyterian and many of the people joining here. How do you actually, in broad terms, solve this problem?
So like I mentioned briefly before, we have different policies on what is sent with what. Like I mentioned, we use the SnapCom ticket tape for immediate alerts, outages, critical items up and down. We have color coding depending on what the message is. We use the SnapCom alert banner when we have census overloads or the ED is full. We use a severity page. We'll send out through Everbridge. We'll send out a group page. We need to get everyone into a group to solve an issue or talk about something via Zoom. We have the global emails that are only sent enterprise-wide or specific to a distribution group. And then we have, like I mentioned before, we have these town halls every day where the executive staff. Well, right now it's every other day, but soon will be every day again because the surge is coming on to talk about the 10 or 15 top topics, so everyone can see it then, or at least on the website, go back and watch it later. And this way it's a single word. If you have too many channels or too many authors to these channels, sometimes the messages are given out differently. And we want to make sure that there's a single author for the communications in each one of these venues.
Yeah, and we can see that you have multiple channels here to address the different needs.
Yeah.
Correct.
Were you going to say something, Anna?
Yeah, I was just gonna say another way that we communicate is actually something we already had today. Is we do a all call, so to speak, called the Opus Beat, and we are able to communicate the information to our to people in our corporate office and down into all of our centers. There's around 230 people on the call, and they get that information directly from the horse's mouth, so to speak. And then, then they all get that same clear message. And that was really why we had brought that on a couple of years ago, was so that they were getting the appropriate mesh, getting the correct message and getting it clear and concise, and they can ask questions. It's a whole presentation, and we have all kinds of disciplines from our organization that participate in that.
Sure. So you have some top-down communication tools that help you spread kind of the important things, but
Right.
you also have those spaces for face-to-face communication to reinforce this message.
Right. And then that message is also can be accessed by the team members that, or maybe our frontline team members that aren't on that call. They can still access that. And also the agenda that is presented also gives all the tools to those administrators, those directors of nursing, and the other department managers to be able to have their additional meetings that they have with their team, and they can explain those things, and then they have the direct information right there.
And I'd really like to go into the different channels you use and the different topics, because what you were mentioning did include some probably top-down communication. For example, right now with coronavirus, Mark, you shared earlier that a great tool that you're using is to inform people about the capacity of the hospital, the census of people joining. So I'm actually just sharing one of the examples Mark shared earlier of what they use, and they have surge level 1, surge level 2, surge level 3, which is basically a scale that helps us understand the capacity that is so important right now. We really need to be moving patients around quickly to make sure that we can cater for those that are most in need. And this is an example of top-down communication, Mark, where the staff need to know how many beds they have available.
Right. Yeah, this example itself right there comes from each one of our hospital EDs. We have 11 hospitals in our system, and their local bed manager, ED manager, if they see that they're going to become full capacity in the ERs, they'll request through IT to send out this banner, and we'll send it out to the local campus people, understanding that this way the nursing staff or people that are on the floors are like, oh, I need to push out these discharges. Let me make sure that this lab work is done so I can get this person out quickly, because there's soon going to be another person wanting to fill that bed. And it just helps keep the flow of patients in and out, knowing that we're getting full in the front, that the back needs to work on getting that clear and have available beds. Or to the point of, like with COVID, do we need to know that we're opening up another area for patients so we can process the surge of COVID patients coming in.
Perfect. And how do you choose one channel over the other? Like in this case, you chose to share this with SnapComs. How do you choose which channel is the best one to deliver that message?
Well, it depends on the message. Like I said before, we have a standard. So when it comes to these surge alerts like this, we send them out through the SnapCom alert, because then it pops up in front of your screen and you must click on it before you can go any further. So it forces you to read it. You know, unlike the ticker tape that sits on the bottom as it's there, but you don't have, it won't stop you from working. This alert does. You have to click past it. So you have to almost acknowledge that you're reading it.
Yes, and you mentioned other channels like Everbridge for emergencies. That is a pretty important system that you use. And in the past, you also mentioned Teams and other collaboration tools.
Correct. Like I said, depending on what we're talking about and the different layers, there's 8 or 9 different venues, and there's probably 20 different scenarios that they all fit into. And they each have their own criteria. Like you mentioned before, if it's something critical, we may use 2 or 3 of those. Like when we do Everbridge and we send out a group text, either a notification that goes to everyone's cell phone, it also sends an email. Then we might do a SnapCom with the same message. Like I said before, a lot of times we use the Everbridge for those emergency pages. That's not just the clinical staff on site, but if we're using Everbridge to mention earthquake or anything terrible, that'll page everybody in the organization, or depending on the groups you pick, no matter where you are. Because SnapCom really, like we mentioned, is only on in-house or remote workers that are on their computer. And so we focus those alerts to focus on the people who are in front of those computers. But with the Everbridge, texting and emailing, it's to get the word out to everyone, everywhere.
Perfect. So we can see some top-down communications and some communication that needs collaboration and interaction, peer-to-peer communication, or being shared in social networks. Now, top-down communications became a little bit frowned upon in the last decade, but it does have its place. Like there's some very important things that need to be spread throughout the organization. Do you think there's a place for both types of communications?
I'll start.
Go ahead, Anna.
Yeah, absolutely. Well, they're just going to go hand in hand. I mean, you're going to use that when you're you have that as you refer to a top-down or cascading communication. You're going to give that to like we do with our Opus Beat. You're going to give that to the senior staff, in our case at each skilled nursing center, and then those department managers, and then they're going to give that peer-to-peer information to their teams as well. And so, the way we have that set up, we have a PowerPoint that has all the information that we provided. We provide a video, and then we have an agenda from the day. So it's a little bit easier for them to be able to get that information back to them in a clear and concise manner and answer any questions that they may have.
Perfect.
So,
and I really want to focus on clear and being concise. Like it's really important to send consistent messages in clear ways. How about you, Mark?
So like when you mentioned about the word top down for us is really when there's an enterprise level issue and it's the senior leadership sending a message out, or like IT giving a global message. But we also have it broken down by campus. Every hospital we call a campus because sometimes it's multiple buildings, but each campus has its own means of communications. We have a thing through the ITEL process called daily huddles, where every day the leadership meets and talks about things that are important to that campus. Sometimes it's information from the top, sometimes it's information from the bottom. And as well as we talked about that, we have the means to SnapCom to send messages directly to only one campus or to maybe a specific department. So the message only goes to the audience that cares about it. There's nothing worse than sending a message out about a hospital here in Brooklyn, and everyone else is getting it, and they really don't care that they might miss a message that's for them. So we were always very aware of making sure that the message is sent to the audience of need.
Yes, it's very important to understand who you're talking to because you might need to adapt the language. And now, what kind of messages are you sending? You've shared a few examples about emergencies when it comes to earthquakes and things like that, IT outages, and you've shared a few examples already. Are there any other types of messages that are important for you to get across to your staff?
Well, like I mentioned, with the IT, we own the communications to all the desktops through SnapCom. We have an emergency management department that uses Everbridge for global issues. We have depending on the situation, could use either a SNAPCOM or a global email if there's a critical change in a piece of medication. You know, every once in a while we'll see a message pop up about, you know, X drug. It needs to come off the shelf now. You know, it's an immediate alert. That'll go through that. That'll come through SNAPCOMs also. Even the point when we first came on board with the COVID protocols, some of those went across the bottom as messages. We also use the messaging system through our EMRs, reflecting if this is a COVID patient, we want you to follow this protocol. So
the information was changing very quickly, and you needed to provide the latest updates.
Yeah.
Correct. And we do everything. Like, you know, like I said, the one thing we don't like to do, or like there's a media for every message. If you're having cookies in the conference room for someone's birthday, that should be an email sent through your department. You know, that's not going to go through all these other global.
To a smaller group.
Yeah. Well,
Yes,
years
I
ago
can
it did.
imagine.
I mean, that was the problem we had when we first started utilizing this technology. We were sending every message to everybody, and you know, it became too much. And all of a sudden, the ticker tapes were being ignored, or even
Yes.
the global emails. My boss is very clear about we only send a global email out when we have to. We make them departmentalized. We make them to only the audience that needs it.
Okay, so it's really important to prioritize the messages, and depending on the priority, choose the right channels.
Mhm.
How about you, Aina? What's been your experience with sending other types of communication?
Yeah, so we've implemented numerous things that have come into play since COVID. One of the big things that we've utilized for our team members, which was actually an idea that came from one of our center administrators about communicating as we were having to have our teams tested more regularly for COVID. It was just a lot of information. Our management teams were having to call each team member or post flyers or things like that, but they needed an easier way to get that information out to them fast, because as you know right now, information just needs to be instant. And so we actually implemented a text messaging platform for us, and it's broke out by location. And we can send out in a moment's, notice. I just get an email or a message from that administrator, whatever the specific administrator, they give me the testing dates and times, and we text blast that out to our team members. And that's been hopefully giving our team at the center some relief of having to have that step to calling everybody. And plus then they just get it. They don't have to reply. They don't have to give an answer. They just get the message and they know the information. And we've had good feedback from that. And we were glad we added that in. And then we also had a feature that we added for our customers and families. We have Clinic Connect system that communicates out to our families, where our families and customers were able to choose how they wanted their messages to be relayed to them. And this was about COVID, COVID reporting and weekly updates. And it came right through the system. And then it was also part of it integrated with their electronic health record. So, all that messaging was there, and families loved that. They loved that constant communication they were getting, and that they are getting, and they had choices on how they wanted to receive it as well.
Okay, that's actually really interesting, and we can see the different channels that are being used here. How do we actually harness the power of the different channels and understand which channel is the best for each medium, and being able to deliver messages at the right place at the right time to the right people? Anna, why don't we start with you now that you're
so I think it's that feedback that you receive. I mean, we received, like you said, we were in a strategic meeting in the thick of this with all of our teams, and this was feedback from one of our administrators, and we do take feedback very seriously from our teams, all over the company. And we use this, and we found that this would be a good way to communicate, and it helped them. It helped the other team members that are receiving the messages. You just have to try it and see if it's going to work. I mean, we also send email blasts when necessary to team members as well. I think you just have to try it and see if it's going to be something that works for your organization.
Sure. And Mark, how about you? How do you make sure that the message has the power to actually make a difference? How do you harness the power of the different channels you have?
Just like Anna, everyone loves to give their opinion. So we've been very good about accepting feedback from people, especially over the last 2 years. Executives will call and say, this is, you're flooding the airways with this stuff. This shouldn't be here, or more. Why didn't we get this message? Why was this not done like this? That's why we've been very dynamic in our, adjusting things. But we still have our rules, but we add or remove from it as we need to. And making sure that the message is getting to the right person and the right audience. And that takes adjustments. Like I mentioned a couple of years ago, it was just a wild, wild west, and there was no control. And from feedback and complaints, we've been honing it down and honing it down, and you're always learning, and things are always changing. So it's not like you can do it once and expect it to be perfect, but at least we have a lot better available control of getting the message out to the person who needs it.
Yeah, it's a constantly learning and evolving process. I mean, especially with the pandemic and everything, it's been a time of rapid change and rapid adaptation. But I really like how this actually is the perfect segue for our next topic, which is working together. You've talked about listening feedback from the different departments, and in a hospital we have quite, a few departments, from clinical to admin and different departments working together. So who do you say you work with more often to communicate to staff? Like, who are the departments trying to get messages across, trying to reach out to staff? And why don't we start with Mark?
Oh, okay. So we get a lot of messages from HR, health and welfare, benefits, that we utilize the screensaver technology for messages. Annual benefits enrollment, hospital training. We also get the same thing from our infectious control clinical staff about the proper way of PPE and what to use, and washing your hands, reminding you to do all these different things. We get a lot of detail on the screensavers from our marketing team. And I showed you, there's one of those slides about, we were publicizing some of the great chalk work. There were some kids that came out and drew these beautiful thank you diagrams in front of the hospitals. So we get that message out, just so it's not always just rules and regulations, but there's some feel good things in there. But like you mentioned with this, a lot of this is just reminders. Like I gave you before, I think we have 72 slides that we break up in groups now, because there's just so much out there. But we get a lot from, like I mentioned, from HR, from benefits, from the marketing people, as well as the clinical side. If there's something important that we need to get out there about, like I mentioned, maybe not a drug, but maybe a proper PPE, or most of the clinical staff understands the difference of what they're wearing, because they've been clinical for so many years. But like the proper eyewear, what is COVID protection eyewear? You're just wearing your glasses? No, you got to wear goggles. You have to wear the face mask, the shield. I don't know if it's on there was a screen purely about proper eyewear, and just reminding people, in the hospital organization, I'm not sure about with the skilled nurses, but we are evaluated every 2-3 years by the system called the Joint Commission, and you are certified. And they just show up one day, and they're in your books, they're all over the place. So we'll put out messages like this, remind people what are the 7 or 8 things they're always going to ask. What is safe? What is pass? What is rush? All these different codes we have about fire extinguishers and fire safety, and where's your exit. So we'll put messages about that out there also, just to quickly, gently remind the staff about those 5 or 6 questions we know they're going to ask everyone.
Perfect. So I guess what I was sharing while you spoke was, I first showed the screensavers that you have around keeping staff motivated, and how important it is to share lighter messages that support staff, that I guess kind of those bits of information that are not only useful, but also help us feel good. I guess during COVID especially, it was such a high stress environment that it was really important to share counseling service, so doctors could actually get access to these support mechanisms that you had in place, but at the same time reinforce important messages that you've already shared, so that you can meet the criteria in terms of maintaining physical distance, washing your hands, using PPE appropriately, and all of these things.
Correct.
So these are some of the examples that Mark shared with us earlier of what's being shared in the different screens and computers in York Presbyterian at the moment. These are probably all from a couple months ago, but you keep renewing them so they don't become part of the landscape, right?
Correct. There's requests almost on a weekly basis for different things, even to the point of updating screens. Or, we had this, when I first inherited this process from a different group 3 years ago, there were a bunch of cartoons, and they had decent messages, but they just kind of had the cartoon look to them. And so my boss helped us build a process, and that you notice that there's a standard here about what is said, what's the font, what's the color. We try every picture, we try to make sure that is an NYP employee and not something from the Getty file. It's just things like that, and it makes a difference. I was hoping you'd had one about those chalk drawings, because those made a huge plus, a huge push for people, made them feel good, because there were some beautiful drawings made by the kids in the street thanking
Yeah.
us.
And actually, many other hospitals were trying to do the same, just make their staff feel appreciated, being at the forefront of this global pandemic. And during times of high stress, it just helped people communicate better.
Yeah.
And you, Anna, you also share a few lighter messages like the ones I have right now being shown in my screen,
Right.
but also remind staff how to wear the equipment appropriately and everything.
Yeah, so the route that we go with our screensaver sizes, it's a big combination. It's the information that they need on top of some other information that feel good information, or just something to make them laugh, really.
Mm-hmm.
But I mean, we have W-2 information that they need to know, that updating your addresses, all that information. But and also we give reminders in there of our ongoing standards of things. We have mission words, which are words that are pulled from our mission statement. And each month we have a new one. And so each month we post that. And it's just a reminder from our mission statement, these mission words on how business should be conducted, because everything goes back to our mission statement, and that's how we conduct business every day. That's our guide. And so it's things like that that we remind our people about each day. And then, from those mission words, we have stories. And so we'll post stories and pictures. Our people love to see themselves and their friends and their coworkers on the screensaver. So a lot of times we've got phenomenal pictures of our people, either just doing their job or having fun, and that's a really highlight for them to be able to show those pictures on there and to see themselves. And our organization is actually goes across all of the platforms, or all of the buildings, so they have the same message. And so you might see someone in Jacksonville when you're in Largo, and so they get to see their fellow team members that they may not see all the time or at all, but you may talk to them all the time, but they'll get to see their face pop up on the screensaver. So
perfect. So we can see quite a bit of different information coming from different sources. How do we actually make sure that we're collaborating together and that the information is pertinent and doesn't create more noise? Because we were looking at a few examples here. How can we make sure that we reduce the noise and avoid communication overload? And Mark, why don't we start with you?
Well, like we mentioned before, it's about prioritizing the message and then making sure the message is sent to the proper audience. Because if you're a clinician, you're working on something, you see a red ticker tape and it's about a hospital 30 miles away, that just wastes time for you. Or, we talked before about, one of the beauties of us with this, the SnapComms for alerting, is avoiding someone calling the service desk. If I have a major outage and they see it on the screen, they don't have to waste time picking up the phone and trying to call my service desk to tell me something I already know. The phones might be jammed up because we have hundreds of people calling at once because of an outage. This way you see it and you just move on. And depending on what the situation is, you can jump into either go into downtime or pay for an alternate solution for what you need while the system is down. So it's a huge enhancer for us to get the message out and out early.
Perfect. So I guess just being appropriate with the timing and being able to deliver that message when the system's down, so people don't waste their time and start kind of goofing around to try to solve something that they don't have any control around.
Correct. Or the key point up.
Yep. How about you, Anna? Sorry?
I'm sorry, just saying one of the other important things is being notified quickly when the system is back.
Yes, of course. So you can go back and fill in the forms that you had to fill in and everything. That's actually really interesting. How about you, Anna? How do you make sure that the information is pertinent and avoids adding to this clutter?
So we just, making sure that information is simple and direct. When we use our screensavers, or really anything that we have that goes out, whether that be on social media, if there's something we need to express to them in that manner, or emails, it just has to be clear. It has to be simple. It has to be direct. You can't just have a whole thing of information, or it just your message gets lost. So when we prepare those messages, I work with whoever is giving the message at the time and make sure that we have that message prepared properly, so that there's an understanding on the end users side, that they get the message they're receiving. So, and unfortunately, you can't control the amount of information that's coming in like it has with COVID, but we do have a responsibility to share that information. So.
Yeah. So we've talked about messages being sweet and short. Sorry, Mark, go ahead.
No, I just want to finish. We talked about this before, but sweet and short. We have a standard on the messages and the length of them, because with Snapcom, you could put out a 2-page paragraph about something, and our rule is that it's only, I think it's 20 characters or so. I have a few of my people on my staff that are the Snapcom police. They make sure that the messages are correct. We have a standard, and it's date, time, location, the issue in a few short words. Because we've had a few times where we'll get an executive saying, "I want you to say this," and all of a sudden, across the screen is this thesis about how we invented radiology. We don't, it needs to be short and simple, because especially on Snapcom, if it's more than the screen worth of messaging, they're never going to get it. They're not going to sit there and read something for more than a few seconds. So it's got to be short and specific. And it's the same with our Everbridge paging.
Perfect. So I guess
any messaging, really. I think he's right on the money. You can't give them a novel, or they're going to lose the message in it, and then you've lost that communication you have with that person.
Yes, we always try to probably put too much information when less is more. Actually, in most occasions, Mark, you were also mentioning of mechanisms to make the messages be comprehended in shorter amounts of time. So using color codes and using different types of resources to make it more available and easier to understand. Can you expand a little bit on that?
Sure. If you want, I don't know if you ever want to share that slide. We have an actual standard, especially with Snapcom. It comes in a couple of areas. Obviously, if there's an outage or a major issue, it comes across as a red banner. Yellow is about notification or impairment, an unscheduled outage. You'll see there. Green is an all clear, and then blue is informational, giving you forewarning that there's a scheduled outage for later in the evening. And then sometimes we have it's a white banner itself that's plain. That might be something informational, like I mentioned. Today's the last day for benefits enrollment. Something that's minor that people can look at or not, or they'll catch their emails. But it's also not just the color coding, but like I mentioned before, there's a strict standard about what can be said and how much can be said.
Perfect. So we're talking about color coding, using different icons and everything to create message conditioning to make it better for these messages to be understood quickly. Anna, do you have anything to add on how you actually make it easier for staff to look at these messages?
Well, I definitely learned something from Mark today. So I learned something on this webinar, is that color coding. I think that's a great idea that you utilize the color coding. Whereas this type of messaging is a larger part of your communication, is not as much for ours, but I think that's a great idea to do. Ours just really go back to that. We try to keep our messages up on our screensavers for a longer period of time, not too long, but long enough that it's they're going to see it, in between working. And again, ours are on 1,200 devices throughout our centers. So they're on kiosks and on the walls of our centers, and they're on people's laptops and desktops, and and I think that's another reason we try to add in not just the informational, but some positive and uplifting information, and daily doses of laughter. It is very powerful and just a recipe. But along with that is that reminder for an informational, like benefits. We did the same thing. We utilized a benefits that Snapcoms for benefits for our team members, to let them know the dates, and it ran for a while so that they would remember, this is, I got to get my benefits open enrollment done.
So reinforcing the message is also really important, and doing it in a way that's not too intrusive, like using screensavers or posters or.
Yeah.
Okay. Perfect.
Posters I don't know, the posters I think are going away, the print media.
Yeah. So some companies still use it though, but.
I think there's still a need for it. It's just we've moved. I think with COVID this year, it's really shifted us forward a lot, and given us that way to add different platforms. I mean, we added pages to our website that we didn't have before, because we needed to get the tools and resources and information out to our customers, our families, our team members, and we needed to have a place to put that for them. And so we put it all out there for them.
Yeah, I agree. Especially the world of COVID, a hospital might be clinical, but a hospital has a huge back office environment. We have about 7,000 people that are all working from home right now, out of the 40,000 that are in our fleet. You know, we have the frontline workers, but we have a lot of people, including myself, who work from home. I have been working home since March, and there's no true, you know, light at the end of the tunnel, at least in the near future. So we got to be able to get those messages across, as well as we use the screensaver to drop the. We don't like screens being open. Obviously, there's clinical information on them. So there's a certain time. I apologize. I can't remember if it's 10 minutes or 15 minutes that the screensaver jumps right on to make sure that that open console is not available for anyone's eyes.
It's 4 minutes.
Yep.
Mark, you're set to, this is Beth, it's set to 4 minutes.
Thank you.
We have a fact checker here on the room, so
I'm a
that's
CFO,
always
so
good.
I know that. 4
Yeah,
minutes
perfect.
for HIPAA for your screensavers. There you go.
All right, thank you.
Yeah, perfect. So how do we know that a message has been successful? Like we've been sharing messages through tickers, through different sources. Mark, in previous conversations, you've mentioned Teams and Zoom and other tools that you're using. How do we know that a message is successful and it's met its objective? And Anna, why don't we start with you this time?
Yeah. So we definitely we get that feedback, and if we aren't given that feedback, we ask for the feedback. So we have some of our consultants that are with Opus that visit our centers every week, every day. You know, there's someone always from that consultant team is at our centers, and they ask for that feedback, or you know, our people give that feedback to us, and so we are hearing that what's working, what's not working. And if need be, addressing that or making alterations where need be. So we get the feedback.
Yep. How about you, Mark? You've mentioned a few times, you mentioned a few of the mechanisms. How do you know it's actually successful, a message?
Well, it's a couple of things. Obviously, with the SnapCom, what it does is my team, you know, I own the service desk and the service restoration team. We have every SnapCom group we're in. So every time there's a SnapCom that goes out, our team sees it. So we'll know when it's coming across. Most time when there's a SnapCom of importance, we're already on some kind of severity call talking about troubleshooting. Because obviously when you get on the call, you talk about escalation notification, how are you going to start troubleshooting, who do you have to notify, and what are you doing about it. So on there, we'll send out the SnapCom, then we'll get feedback from people saying, oh yeah, I see it, we're good. Or like it happened a few weeks ago, someone said, who created that message? You know, we get a lot of that. And also we get the feedback from the clinical staff. You know, we have a very open door in that. You know, anybody can come to me or my boss's boss and say, you know, you did this last week and I'm really not happy with that. Or my boss or the CIO is always open to coming to us saying, hey, you know, Mark, you do this, I'd rather it look like this. I think this is more how the end user would like to absorb it. And we make the adjustments. You know, that's what we do here. We don't have this is not the 10 commandments in stone. We have to adjust this thing as things come across.
So feedback is really important, but also the impact of the message. Mark, you've mentioned before that before we started the webinar, that when you send a message about an outage, you know when a message has been sent because you receive quite, very few calls of people asking, hey, what's going on? The system is not working. And that's really important for you and your team.
Correct. We do that. When you're on the severity call, we'll talk about calls in queue. And, you know, hopefully when we're seeing that, we get the message out there, that call in queue will go from 100 to 0 or down to 1. So we at least will know that message was clear enough. Or if it doesn't stop, then we're like, okay, you know, maybe we need to see something else. Maybe we need references in a different way because people are still calling, and the service desk will be on the phone with us saying, hey, we're calling. They're not mentioning about this one. I don't want to say an actual application, but they're not talking about the EMR. They're talking about the lab results. And then we'll put the message out to say it's including this.
Perfect. And I guess just wrapping up the session, we've already seen a few lessons that you've been learning this year. Would you mind telling us, looking back at what we know now, what are some of the best insights you can share with the audience here of what you've learned this year?
I'll start. Yeah. So, I wanted to get a good broad mixture and understanding. So I asked a few people here as well on this, and we all kind of agreed as far as snail mail. And for us, in long-term care, we had so much information that we really needed to get out, and there was requirements of messaging that needed to get out to our families, to our team members. And, you know, we were sending letters in the beginning, and it's just, there was just too much, and we needed to get information to our families and our team members faster. So, you know, really, I think that snail mail, just doing it is a thing of the past, not completely past, because obviously there's still things that need to be mailed. But that instant information that we need to get out to them, you know, we learned, you know, we added that communication to social media if necessary, to our website, to that COVID page if necessary. You know, and then we also sent out that electronic messaging and the text messaging to our team members, and we've just added all those things that are lessons that we've learned. And again, I think it's just pushed us forward into a different, a new and different and exciting areas way to make sure that everybody has the information that they need.
How about you, Mark? What would you say you have learned this year?
Well, you know, being an old Boy Scout, be prepared, because, you know, what happened in March is we were not prepared. We did not realize the impact was going to happen. And it took a lot of effort from the, you know, I commend everybody at NYP for really doing, you know, an amazing amount of work in just a few weeks preparing the hospital, going from 400 ICUs to 1,500 in 2 weeks. And the point of being flexible, you know, the old days when you talk to your grandparents, he did the same thing for 30 years. Well, those days are over. You know, what I did this time last year is totally different from what I'm doing today. You know, like Anna mentioned about social media. I mean, we might start putting SnapComs on, I hate to say, I don't know, but like Twitter or Facebook or whatever. You know, you have to be understanding about how the world is now. Everyone's got a phone in their hand. We have the communications now. We're talking about how we're doing messaging through mobile devices, because that's part of our EMR, because a nurse and that doctor always has a mobile device in their hand. They're always going to be able to communicate with each other that way. So truly, it's you got to be flexible. You can't, you know, a person says, well, I used to do it this way. Then I'm like, well, get in a time machine, go back to that, because we're pressing on.
Perfect. And is there anything that you're going to start or stop doing, Anna, this next year coming ahead?
Well, you know, we added with the visitation restrictions that we had in Florida, that you know, for a long time the families were not able to come into our centers, and now that has been lifted a little bit with some still some restrictions, but we added training for our families, and we added that to our website, and we were doing it at first there right with them, and our wonderful team of learning specialists and learning department, they put together a presentation and a video so that families can review that information before they come, and then they're not spending that time that they want to spend with their family member going through that information. So they can do all that before they even come. So that was something definitely we moved forward with. And again, it's just that electronic messaging, whether that be of course email, but email blasts and text messaging, and the messaging through the internal systems to the people that need to get it.
How about you, Mark? Is there anything that you will start or stop doing next year?
No, there's nothing we'll stop. You know, right now we haven't really dropped it. It's funny Anna mentioned about snail mail, and, you know, printing things on paper. You know, luckily enough for me, I don't have to worry about that. You know, we don't really have when I first started many years ago, everything was done via memo. You know, before we had email and all that. So luckily enough, this last year, I mean, we learned a lot. There's a lot going on. I can't think of anything that I'm going to stop doing, because we're trying to do everything we can. There's so much change, you know, trying to coordinate with, you know, 5,000 people that are home, not in the office. Our telemedicine department, we were a leader before this happened. Now it's exploded. So there's just more and more happening. And, you know, the only thing I would say that we're not going to do this year that we didn't do last year is have mandatory meetings in an office. I mean, that doesn't exist anymore. You know, we're not going to have cookies in the conference room. We're not going to have one-on-ones where I'd love to be able to sit and chat with people, but it's just not the mean, especially here in New York City, where you know, it's, I don't want to use the word dangerous, but it's, you know, it's awkward to travel mass transit right now, because many people are doing proper things, but there are a lot of people that are being very careless, and you don't want to get exposed. And there's no reason for that. So many of us like the remote working and being safe, and then we help support the people who have to go in. I have my son has to go in every day. I have friends who are nurses and doctors that have to go in every day. And, you know, we have to always kind of work on how we can support them in that and make their life easier, because they are carrying the majority of this burden.
Perfect. And you're completely right. I guess because of time, we'll probably be wrapping things up. But if there's any questions in the audience, please feel free to ask them in the chat box in your console, and we will be answering them shortly. So start typing. Beth and Todd I mean, we have time for probably 3 or 2 questions, so if you can share them. And in the meantime, as they arrive, I just wanted to thank you very much for joining again. Some of the key learnings that we've seen is, and I'm going to try to summarize some of the things that have been said, is the first key learning that I saw from what you mentioned is that we need to be brief. So I think Twitter limits your character count at 280, if I'm not mistaken. So, I mean, we're all come from a social media generation or have been exposed to social media where less is more. So it's really important to be brief and go to the point. The second learning that I found really interesting was being able to choose your communication channel wisely and to be consistent when it's used. So we're creatures of habit, and Mark, you showed us a few examples of how color coding and simple things like that can actually make a difference in how we digest information. We're all very visual, or most of us are very visual, but that's something that's really important. And at the same time, you mentioned that using different channels. I'm sure that also helps people that probably learn a little bit different, and just using the whole ecosystem of channels we have. Something that I found also really interesting was that we don't have to be afraid of flooding channels when it comes to emergency messages and critical things that need to come across. But when it comes to saying, hey, there's hot dogs in the lobby, let's just try not to share that with everyone, just with the specific people. And I guess one of the last learnings that we'll be sharing is just being using the full power of the channels that we have available. Get to know what we have, get to know what each channel is good for, and use that. Anything else that you think that is worth sharing?
I think we covered it. I was excited to be able to share what we do at Opus, and hopefully will help others and maybe spawn more questions. You know, we all can learn. At Opus, we have a phrase, part of our mission statement is continuously improving, and I think 2020 has that set of words, continuously improving, was definitely awards for 2020. So we can always continuously improve and learn.
Yep. Yeah, and I guess
This is Beth.
yes. Yep.
I just want to put a little plug in here for the CSM team. Anyone who is working with your CSM, we can certainly help you to create some of the successes that Mark or Anna have as far as their governance and their best practices of using the color coding or creating templates that have your target staff to reach. That please reach out to your CSM team. We're here to help you, and we can help you with anything that you've learned today in you know, making that work for you as far as using the different tools that you see here and how to you know, improve upon and use what you've learned today.
Perfect. No, that's a really good point. And I think we have to wrap it up because time is over. We'll probably, for those that want to stay, we do have, I think, 3 questions waiting to be answered. But I guess we all have different messages that we have to send to our people. And I wanted to share this diagram here because these messages go from critical to social. And they have different levels of priority, and how we actually look at them can help us choose the right channels to be able to distribute them. So we will probably have an emergency management system that will help us deliver the critical, most important messages, but also we need to be able to share messages from the CEO, welcoming new staff, and sharing those messages that you share that are really just to, you know, make people laugh and make people a little bit feel better in their job. So it's really important to consider these messages, but consider the channels with which they are shared. So we're going to wrap it up. Beth thought, I mean, for the people that want to stay there, I saw that there were a few questions on the line. Would you like to go ahead and ask them?
I'll just say there was 1 or 2 earlier on, but I think through your questions and Mark and Anna, your guys' great answers, you actually answered most of them. But Beth, there was that last one. Did you want to ask the one about the gathering feedback?
Go ahead and ask that one.
Okay, cool. 1 second. So there was one question here. How do you take into account the opinion of your staff in your communication strategy or the tools you use?
So Anna, I think you mentioned that it was really important to get feedback. How exactly do you get this feedback?
So the example that I had given, we, like I said, we have a consultants that are in our centers all the time, and they're communicating directly with the people. But you know, we might be maybe a little bit smaller on the front as opposed to Mark. Is you know, also we're talking to our people every day, and so they're telling us that feedback, and you know, then you just take it and evaluate it. And you know, sometimes, you know, we might produce something that they're using every day. We may use it, but they might use it a little bit more, and they might have a better feel for it. So, you know, we may not realize that they're making all these calls with, you know, to try and get let our team members know about about COVID testing. But that's how we, you know, they give us that feedback, and that's how we learn, and that's how we continuously improve. So we ask for it, and they don't mind giving it to us, which is totally fine for us. So we used to do surveys. We had surveys last year. Obviously, that didn't get to happen this year because of COVID, but we also did team member and customer surveys each year to gain that knowledge as well.
Yep. And Mark, if you want to wrap up that webinar and give me your last recommendation on how to take into account everybody's opinion when creating and crafting messages.
So the one thing my team does, I have a team that owns the operations. They're called the incident commanders of the SIM squad, and we have a daily call. Mainly we have a daily call because we're COVID, everyone's all spread around. We can talk to each other. We have a morning call every day for an hour, and we talk about what happened the day before, or 2 days before. And one of those is about messaging and alerting, and that's how we talk about making sure we have to re-educate people about the standards, or you know, should I have made this a severity 1 or should this have been a 2? So we have a constant dialect going on about how we do things. Like I mentioned, you got to be flexible. We're not going to invent the policy that it lasts 10 years. But the daily review of this helps a lot for us. You know, like Anna, she talked to our team in what was weekly, monthly. We just have to do it daily because there's a lot going on our side. So
Yes.
we gotta.
Yeah.
I can't wait for the end of the week. You know.
Yeah, well,
Yeah.
and the reason we had actually brought that, just real quickly, the reason we had brought that, you know, we're always talking to our people. The reason we had brought the monthly on was to get that clarity, and it's going to be for those big things. And what that hopefully helped, what our goal in that, and it did, was eliminate the webinar here, the webinar there, the call over here, the call over there, and taking that time and kind of, we put it all in one time, so you don't have an administrator or director of nursing having 4 different calls in one day when we could have had that, you know, or throughout the week when we could have had that one call. So that's actually why we brought that on. But if there's something that needs to go out, we get it out for sure.
Yep. Prioritizing.
Yes.
So thank you very much. I think we've, I mean, you've shared great little bits of information of what you do on your day-to-day. So thank you very much for sharing with the audience. Do take care. We do have a few questions that we have not been able to respond because of time, but we will be emailing all the attendees that asked those questions. So thank you very much, and have a great rest of the day, and enjoy your weekends coming up in a few days or one day. Take care. Bye.
All right, thank you.
Thank you.
Thank you very much.
Thanks, guys.